After 3 years of enduring some of the world's most stringent COVID containment measures, on December 7, 2022, China abandoned its zero COVID policy. Overnight, mass testing, lockdowns, and travel restrictions were relaxed.
The speed in which it was done took the world by surprise. Now, the question is that wrong?
I think it's the right course and then high time to open that. It's highly expected by both people in China and outside China.
But in less than 2 months of opening, infection and deaths skyrocketed.
I don't think it's implausible that there's been a very large number of COVID deaths.
As citizens grapple with the disease,
我个人感觉确实有些快。
疑惑，就是我觉得可能99%吧，甚至可能更高的比例，大家都是疑惑。但是从疑惑到大家马上自己就阳了，然后去自己就马上要面对这个疾病。
Was China caught off guard by the scale of infections? Or was this part of its COVID exit strategy? It's a busy day for Mr. Wang. Ever since China lifted all its zero COVID policies in December, business in his small eatery in Xi'an has been brisk. It is a welcome change for the 60-year-old who saw his business battered by the pandemic.
我作为是一个搞餐饮的啊，那么首先这个疫情期间，它不是要禁默呀，要风控啊，那么。首先是在这个人的这个流动上面受到了限制，那么实体店冲击应该是非常非常大的。你开着店没人来光顾啊，你这生意就没法做啊，这就是我的切身的这种体会。那么各行各业一定是都受到了很大很大的影响。这是我们公司。
For 3 years, China had imposed a strict zero COVID policy. This meant trying to eradicate the virus within its borders, which involved prolonged periods of lockdowns and quarantine. While the rest of the world reopened, China stuck to its guns, maintaining tight controls. But the restrictions would have repercussions. The World Bank estimates the Chinese economy grew just 2.7% in 2022, the lowest in 40 years.
The CCP is looking at the economic numbers and figure that they probably need to open up to boost their economy in the wake of the demographic decline, in the wake of the maturing economy, and of course the effects of the closures.
Zero COVID policies abruptly came to an end late last year. On December 7, 2022, Beijing began to ease COVID measures. While Mr. Wang welcomed the move, just days after the relaxing of restrictions, he contracted the disease.
很短的时间，我就已经先阳了。这个阳了以后呢，就感觉开始是身体不太适，有点那个啥发烧，然后浑身就很疼，再加上呢就是有咳嗽啊。这个症状痰比较多，然后最主要就是特别没精神。我先，紧接着我孩子就发烧了，然后隔了1、2天，我爱人这边也被感染上了。
During the 3 years of lockdown, Wang and his family had managed to avoid getting infected. And when he came down with COVID, he was not immediately alarmed.
但是同一个屋子，我们那个谁了，老大了，大儿子了就没事儿，还去打球啊干啥的，啊，所以这件事儿我们从整体的这个上来说，就感觉他既然来了，该来就来呗，那也没有必要，是不是？惶恐啊，这个有些害怕或者担心，因为 咱还得要面对嘛。
In softening the ground for the reopening, the government had changed its stance on COVID. It was no longer portrayed as the devil virus, but rather more akin to the flu, especially for the Omicron variant. But as Wang and others like him soon found out, COVID was a lot more severe.
它确实比感冒厉害得多，而且我身边有些老一点的朋友们，相继有的没抗过去，就是有些基础病的，或者说是自己抵抗能力差一点的，都已经有的都走了，确实不是感冒。说明人们呢还是没有太够的这个足够的重视，或者说没有给大家这个一些正常的一些疏导包括跟有些专家一开始一直强调说什么就像感冒一样或者大家还是不够重视，就这样。
Wang's experience was repeated throughout China. In the days and weeks following reopening, COVID infections surged. Official figures put the death toll at 60,000 in mid-January, a number which has been called into question.
There was a lot of discussion about the definition of deaths in China, but I think that's a smaller issue than the fact that there's very little testing being done. So 60,000, I mean, I think maybe there should be another zero on top of that, or at least in terms of the potential real number. The other studies in the literature have been talking about maybe 1 million deaths in China this winter from COVID.
Affinity, a UK-based predictive health data analytics company, estimated the daily infection in China is 4.2 million. Daily deaths, 34,000.
So COVID-19, whichever the variant is, whether it's ancestral or current, can be equally deadly. All right. The only difference now in the context that we say it can be so-called mild is because most of us who are vulnerable are protected. Because it's going to be a problem if they are not vaccinated and they are not, haven't had a natural infection. Because hybrid immunity, I mean, by which you have had previous vaccination and a natural infection, or a natural infection followed by vaccination, whichever way, is probably not very much prevalent in China. You didn't actually get the infection to spread, so people don't have that hybrid immunity.
According to WHO, full vaccination using China-made vaccines will require 3 doses. And while almost 90% of the population received 2 doses of the vaccine, just 55% have had their 3rd shot.
Since last autumn, actually the Chinese government was already preparing for the gradual opening up and asking more and more elderly, especially in the big cities, to get vaccinated or even have the 3rd or the 4th vaccines. But the process has been quite slow because many elderly people do not really trust the quality of the vaccination.
I think one of the reasons why older people didn't get vaccinated is because they didn't see an imminent risk. So they were maybe not against vaccination, but just putting off the decision because COVID wasn't in the community. They didn't think it was going to be imminent. And then with that U-turn in December, all of a sudden, maybe there's a lot of old people who would have liked to get vaccinated, but it was too rushed. And then they ended up getting COVID in December or January before having a chance to get vaccinated. And that's really a missed opportunity to save many lives.
If you look at other cases of countries or societies that had something resembling zero COVID kind of policy or approach for a time, why did they do that? They did that to buy time, right? They did that to, look at Singapore, for example. We had our circuit breaker, but our leaders made it very clear that the main intention was to ensure that we could get vaccinations up to a certain rate, right? So it was a means to an end, right, in preparation for opening up.
The spike in COVID cases could also be attributed to the quality of vaccines. The two most widely used vaccines in China are developed by Chinese pharmaceuticals Sinovac and Sinopharm. Both use inactivated virus to trigger an immune response and are considered less effective than Western mRNA vaccines. One study by Yale showed that the Sinovac vaccine did not produce enough antibodies to neutralize the Omicron variant. But when the EU offered to donate mRNA vaccines to China, it was rejected by Beijing.
I do not think it's realistic for us to expect the Chinese government to accept foreign-made vaccines. I think the reason is simple, probably due to the national security reasons, because they do not really trust the quality of the foreign-made vaccines. That could be the main reason, especially when we see in Xi Jinping's time, the Chinese government has been talking more and more about self-reliance strategy.
If the decision is to sort of circle the wagon, so to speak, and dig in and just thanks but no thanks, we can sort it out ourselves, then in my own opinion, I think it's a wasted opportunity, unfortunate one. But, you know, nationalism, right? You can't sort of discount the reality of nationalism and the tendency of people to often want to fall back on that. Yeah, but there are costs to doing that, I feel.
With vaccination at inadequate levels, both in terms of quantity and quality, why then did China make such a rapid exit from COVID restrictions? The streets of Beijing are humming with life. Shopping, eating, and festivities in time of the Lunar New Year. Beijing's notorious traffic snarl is back too.
而且有时候赶上周末呀，尤其年前的这段时间，大家走访亲友、串门去买东西啊，制备年货呀，或者一些商业圈啊，都是非常的多的，所以堵车的情况也非常的严重。
Scenes like these were almost unthinkable just a few months before. As recently as October 2022, at the 20th Chinese Communist Party Congress, President Xi Jinping had reiterated China's commitment to the zero-COVID policies.
If we go back to October when President Xi Jinping said that zero COVID was the way forward for the country, I mean, I think that was indicating there was no intention to change direction at that point, no need to make any kind of transition plans or preparations.
So it came as a surprise that barely 2 months after Xi's speech, Beijing suddenly relaxed most of its COVID controls via a 10-point guideline.
So what drove the decisions in the PRC is not entirely clear. They don't have a system that is transparent enough for us to see. I think the protests that we saw last autumn put some pressure on the government to open up. The state's own claim is that they are seeing the current strains that are spreading to be more contagious, but less severe and less deadly. So they're saying that based on that judgment, they're opening up.
We know that actually China's economy was not in good shape since the beginning of the year, largely because of the zero COVID policy, especially the lockdown of the large cities like Shanghai and some other cities actually affected China's economy a lot. So that's why I think the economic management team does not want to waste more time, so they decided to immediately change gears and change to this kind of opening up overnight.
Instead of a gradual opening, Beijing had rolled back almost all restrictions in a matter of days. Overnight, a negative COVID test result was no longer required to enter most places, and those who are sick can quarantine at home instead of in field hospitals.
Perhaps the speed in which it was done took the world by surprise. Now, the question is that wrong? I don't think so, in the sense that at some point you have to open up. So I think if we really lay out all the different things that had to be done and could be done and all that, to me, perhaps the speed was, in my opinion, perhaps a little bit, too fast.
The speed at which China exited COVID was matched by the rate of infections. In just 2 weeks after reopening, Chinese officials estimate that over 250 million people have contracted the virus. Yang Xiao, a media producer and cameraman, was one of them.
也是在北京朝阳啊，就是比较接触易发人群比较多的这个一个灾区，然后去做一个拍摄的活动吧，然后也是串了好几个地方。我在想，有可能就是那天，然后在外边商场或者在外边拍摄的过程当中，甭管呼吸啊还是一种接触的形式，然后就有这个症状的这什么了。除了发烧的这个情况是以前没有过的，就是这个发烧的时间长度，就是以前可能也就发烧半天、一天就结束了，这次可能有一个长达3天到4天左右的一个高烧的期。
Many hospitals were unprepared for the surge of cases, as long queues formed outside healthcare facilities. Medical staff reported a 5 to 16-fold increase in patients.
We've seen an enormous number of people getting hospitalized in the past month. If that could have been spread out to 2 months, it would have made a big difference. Even if we can't stop it, just slowing it down still makes a big difference.
For traditional Chinese medicine doctor Ng Ching-Chuen, these are familiar scenes. He had seen them when his home, Hong Kong, was ravaged by Omicron in early 2022. Then, the island had the world's highest COVID death rate.
咁我哋睇今次咧，我問過上嗰啲朋友親戚，佢哋就話，佢哋去醫院有啲重症嘅，自己覺得好唔舒服啊，承受唔到啦，咁佢哋會去醫院。咁醫院嘅時候咧，佢排咗2-3個鐘，排咗2-3個鐘之後都係輪唔到。咁輪唔到咧，我接觸嗰啲咧。就大部分都係翻屋企休息，咁翻屋企休息佢就會食一啲止痛藥啦、退燒藥啦，飲多啲水啦。
But these medications were in short supply in China, as people began to hoard painkillers and fever pills. When the shelves ran empty in mainland pharmacies, Chinese citizens tried to obtain drugs from Hong Kong.
其實而家醫院藥物嘅存量咧係足夠嘅，咁為咗防止人炒賣啊，或者再次去放售呢啲醫院得嚟嘅藥物咧，咁有啲醫院會選擇散出呢啲藥物，即係譬如一盒有30粒嘅藥物啦，就可能會剪到為28粒咁出。咁雖然工序多咗，需要嘅人手亦都多咗，但係就可以做到防止炒賣呢個效果。其實而家政府咧多咗宣傳，就呼籲啲市民就唔好盲目咁去搶購某一啲特定牌子嘅藥物。咁其實佢哋都用多咗藥物嘅名啦，即係譬如好似撲熱息痛 paracetamol 咁樣，希望就市民就唔好去繼續去搶購某啲牌子嘅藥物啦。
那也就導致老百姓在接受這個消息的反饋也要非常非常短，就要馬上領會這個新十條的這個政策。但是我們知道，從它發售就跟我們之前看缺物資、缺藥品，從自媒體啊、網絡啊或者新聞媒體的這些不同的媒體上看到過這個在急診去發熱急診去排隊，然後也有囤藥這個搶藥的情況。
As healthcare infrastructure was taxed and the funeral homes inundated with the dead, questions have been asked if China was ill-prepared for such a rapid COVID exit.
I think that lack of planning is a surprise to many people, and I don't know what's underneath that, but it was certainly a very dramatic U-turn and very surprising. There's 5-year plans, 10-year plans, and so on. Why wasn't there a plan for this transition that was made months in advance to say, okay, when we stop zero COVID, we're going to have a period of 2 months or 3 months of proper mitigation with mask mandate, with hospitals ready for a surge in cases, with social distancing as much as possible to slow down the peak.
There was that time where certain measures should have been taken in anticipation or in preparation for opening up. And looking at what is happening today, you cannot help but draw the conclusion that they probably didn't put in place all that was absolutely necessary before opening up. And we are in the situation we are in now as a result of that.
Omicron has surged and attacked many countries. All other countries, when it hit the US, Europe, all the countries went through the spike of that. So I don't think that China is ill prepared. Of course, I mean, because the size of China and the population, the largest, most populous country in the world, it certainly had an impact there too. But overall, I think China has gradually managed to stabilize the situation. I think this situation will be stabilized.
Nonetheless, there are worries that rather than stabilizing, there could be another infection spike on the horizon. The reason? The Lunar New Year. An estimated 2.1 billion trips will be made by the Chinese over this festive season, as many return to their hometowns for the first time in 3 years. This could be a vector for the virus to spread.
So it's going to be a catalyst to bring the virus to the vast rural area where people are not immune enough. So whilst the peak of the epidemic can hit the cities faster because of the transmission being faster in cities, etc., it would take a while for the peak to hit the rural areas. And the rural areas may be where more of the elderly people are and more distance they are away from healthcare.
But for outside observers, it can be hard to grasp how the pandemic might play out in the coming months.
The numbers that are being reported in terms of their mortality and in terms of statistics is completely dichotomous to reports from the ground in regards to how hospital facilities, crematoriums, everything is being overwhelmed. So who are we to believe? So I think that this is the kind of information that needs to be harmonized somewhere, and that's kind of where the WHO is trying to get clarity.
According to the WHO, official numbers are likely to have been underestimated. China records COVID infections at hospitals and fever clinics for those with recognized symptoms. Asymptomatic cases and positive results from home test kits are not included in the data. It has also been difficult to get data directly from healthcare professionals due to China's information controls.
And are working ever closer with our colleagues in China to try and understand better the transmission dynamics. But we still do not have adequate information to make a full comprehensive risk assessment.
Concerns over the lack of transparency are twofold. First, it hampers the WHO's ability to provide accurate pandemic risk assessments. And second, the world could be caught on the back foot should a new variant emerge in China.
There's always a possibility that something new could come out of China. There could be 1 billion infections this winter. That's a lot of opportunities for the virus to evolve. And I think it's very important globally that we keep an eye on the virus. And that involves not only testing with PCR, but also doing the virus sequencing. And unfortunately in China, that's not being done very much.
Beijing, however, insists that it is fully cooperating with the WHO, and criticisms of its reporting are unwarranted.
当前中国的疫情形势是可控的，我们也希望世卫组织秘书处秉持科学、客观、公正的立场，努力为全球应对疫情挑战发挥积极作用。
It takes time for them to getting all numbers up. So I think it's still in this process. I don't think they deliberately want to hide anything, or there is a switch of used to counting on the PCR test. Now they are relying on the hospitals now to report the cases. Where at hospital now they have a standard You have to be directly related to the COVID death, then you report. So that's the system, how it works.
So whilst we on the outside like to know what's going on, and the only way we know is data, but for them, they are tackling a crisis at the same time, right? So I guess I'm not trying to make an excuse for China. I too would like to know data, but I think that's a practical reality, that sometimes when you're fighting a crisis, you have to operate in the fog of war.
But what about the citizens within China? How are they reacting to China's COVID exit and subsequent surge in infections?
For 3 years, we've been told that we have to fight against it, we have to struggle against it. It's an enemy, it's a war on COVID, from a Chinese perspective. So COVID is the enemy, right? And then now I have to sort of live with the enemy. Policies can change overnight, but perspectives, mindsets, and attitudes don't change as quickly.
How will the Chinese people view the leadership in the aftermath of the country's tangled transition out of the pandemic? When the novel coronavirus SARS-CoV-2 first emerged in 2019, China's response to contain it was swift. It made the tough decision to implement nationwide quarantine, lockdowns, and mandatory mass testing.
For most of the first 3 years, China did a really good job in stopping COVID from spreading. We would have known if there were large epidemics of COVID in a city in China, because we would have heard about hospitals being overwhelmed with patients. So we know that for most of the first 3 years, the low numbers of confirmed cases were reasonable numbers. There really wasn't much COVID in China.
Following China's lead, a number of countries adopted similar zero-COVID policies, from Australia to Singapore to Vietnam. But as the virus continued to spread over the next 2 years, the strategy of containment was gradually abandoned.
It's really clear that there was no way we're going to get rid of this virus. It's gone too far. So zero COVID, therefore, was an initial and early response. But once vaccines became available and treatments became available, then zero COVID was not necessary.
By the middle of 2022, China became the only major country to double down on zero COVID policies. As recently as October, millions in China were still under lockdown.
Because Xi Jinping has tied the handling of COVID so much to his own personal legacy, so much that any sort of hint that things are out of control could create more questions about Xi's leadership and his judgment. But there are things that even the CCP can't control, and the COVID-19 virus is one of them.
By December 2022, China was finally prepared to ditch zero COVID restrictions. The official reason for the policy U-turn was the lethality of the Omicron variant being comparable to the flu. Hence, a COVID exit was now safe, a message that left many in China relieved.
开心的，对，这个政策来的有点晚，但是这个来了总比不来好嘛。
其实应该是好消息吧，因为疫情影响那么严重嘛，一开始哪也去不了，然后现在能去一些场所肯定是个好消息。
就是告诉他们出门戴好口罩，就还是不要说因为不做核酸，然后不戴口罩啊或者干嘛的，然后家里也会准备一些常用的药，包括抗原自测什么的。
But in the coming weeks, infections and deaths soared. With it came a shift in mood. Chinese social media Weibo was filled with comments lambasting the health experts who downplayed the severity of the virus.
专家说，新冠就是个大号感冒，我们信了，不曾想，高热、乏力、无休止的咳嗽让我们苦不堪言。
To some extent, they are angry at the sudden change of the government policy and the rhetoric, because yesterday they were told that the COVID was a very deadly virus. It can cost millions of lives if China fully opens up and chooses to live with the COVID. But the next day, they were told by the experts that actually the virus is no longer that dangerous, and it has become a kind of a mild flu. So that's why I think many Chinese people are confused.
对前期的这个宣传，还是应该这个不够严谨吧？把这事儿就给淡化了，就感觉轻描淡写的，就是所谓的感冒因为没有好的药，就强调在家里休息啊，居家隔离，多喝水，身体自然慢慢恢复。这个是我感觉，这些所谓的专家有点不够重视或者是严谨。
So I think the protests and then sort of comments bubbling up online these days, we see that there is a sense among the Chinese public that they are not as confident in the regime and how they handle COVID. They are, questioning a lot of the leadership's choices and decisions.
Perhaps acknowledging the unhappiness, President Xi struck a conciliatory tone during his New Year's Day address. In his speech, President Xi also signaled that China is turning the corner on the virus. And there are signs that the worst may be over. In late January, China's Center for Disease Control and Prevention reported that infections and deaths have fallen over 70%. And with estimates that over 80% of the population have contracted COVID, the Middle Kingdom could be on its way to herd immunity.
Actually, the massive movement around the Chinese New Year could help the country achieve the herd immunity sooner. So that's, I think, probably the government's plan as well. Of course, they would not openly announce that, but I do think that once more and more people are traveling to their hometown or to other places, actually more places in China will reach the herd immunity.
But achieving herd immunity can be complicated by variants. As the experience in other countries show, newer variants raise the risk of reinfections.
Xi Jinping's newer message, he did talk about bearing the short-term pain, but that's also a bet, right? It's a bet that they will get to herd immunity without having new strains and variants and mutations emerge that we don't even know about. I think that's the big concern for many.
So what we know now from looking at having studied COVID for over 2 years now, is this, that the infection does in some individuals do not give you as good an immunity as the vaccine. Then in those who are vaccinated, many of us have also gone on to become infected, whether symptomatically or asymptomatically. Right? In that scenario where you have had an infection with vaccination and vaccination with infection, all the lab studies so far have shown that the immunity is better than anything that we could have found in any other combinations. So now coming back to China's scenario, will letting the virus go through the population then create high levels of immunity? It depends on whether they have been vaccinated.
As infection numbers dip, the Chinese stock market trended in the opposite direction. Since the start of 2023, the Shanghai Composite Index has seen a 5-week rally. For some, these are encouraging signs of China's economic recovery after years of zero COVID restrictions.
Things are back to normal. Even now, restaurants, cinemas, stadiums are packed already. People are already less fearful, and then everybody is embracing a new life. I'm sure this year, again, we'll have a double the GDP of China for 2022, which is 3%. This year could be 6%.
I suppose the hope is the economy will be going back to 100%, full steam ahead. Now, it may take time, of course, to get the momentum back, but I think that will be the idea. And there were commentators in China in the past month talking about the idea of getting this wave over with more quickly in order to allow a more speedy reopening after the Lunar New Year. I don't think that was good on public health grounds, but I can understand the economic angle for that argument.
Look at the APEC, the G20 last year. Who was the most popular leader there? Who was the one leader that everyone was queuing up to see? I'll give you a clue, it's not Joe Biden, right? And there's a reason why everyone wanted to reconnect with Xi Jinping, right? It's to position themselves and their economies for the eventual reopening of China for business. And quite clearly, for the Chinese government, that is going to happen, virus or not.
With the gradual recovery, one sector in particular is expected to rebound quickly: travel. But are countries ready to welcome millions of Chinese tourists while COVID numbers remain high? Prior to the pandemic, the Chinese were the largest group of international travelers, logging over 150 million trips in 2019. With China's travel restrictions lifted on January 8th, after 3 years of tight controls, Chinese tourists are able to venture out into the world again. It is estimated that outbound travelers from China will reach pre-pandemic levels by the second half of this year. But some countries appear hesitant to welcome them over fears of renewed outbreaks.
Many countries have sort of learned to live with COVID. They've moved on. They've got certain procedures in place. So, in a sense, there is some degree of stability in societies already, which includes having COVID circulating. And now that China is opening up, people are going to start traveling. Whether that is going to unsettle this sort of stability, this equilibrium, and to what extent, and what are the consequences of that, these are all unknown at this point in time.
If the vulnerable people in any given population are still not adequately protected, and you're going to let in a surge of people who have got as yet unclear vaccination or infection status, then that's going to expose these groups of people.
There are also concerns that a new variant of the SARS-CoV-2 virus could emerge in China and proliferate through Chinese travelers. There are currently numerous subvariants, some very adept at escaping existing vaccines. For example, it is estimated that mRNA vaccines only have a 30% efficacy against the new Kraken subvariant.
These viruses mutate, and so new mutations will always keep springing out. Now, some of them will then cause our antibodies to be less potent in binding to them and killing them, preventing infection.
So far, no new variant has emerged from China. But even if one were to appear, many experts believe the threat is low.
I think that in most parts of the world where vaccination rates have been high and that we have also gone through the Omicron waves or the Delta waves, our immunity in the population is actually very, very high. That no matter what China throws at us, at least for now, we know that we have the immunity levels to protect against it.
Nonetheless, some countries have taken precaution against Chinese travelers. as of January, the United States, Britain, Australia, Japan and South Korea have enforced rules such as pre-departure COVID-19 tests, testing upon arrival, and quarantine for those that test positive. Morocco went so far as to ban all arrivals from China.
I think it's a kind of natural response from China's sudden opening up of COVID policy, because I think many reports showed that there are increasing number of deaths and infections. So I think it would be natural for some foreign governments to change their travel policies upon Chinese visitors, especially when they consider the previous experience at the very beginning of the COVID outbreak.
But these restrictions have aroused anger among many in China. Chinese state media decried them as discriminatory, while social media users called South Korea's measures insulting. In a tit-for-tat move, China halted short-term visas for South Koreans and Japanese travelers, and all visitors to China are required to produce a negative COVID-19 test result.
They are trying to put the point across to other countries. It is not in their interests for them to be keeping China out. The point is obvious, the point is clear, that China is a major player. To be at the receiving end of this kind of response from other countries in the international community for a major power, I mean, whether it's China or the United States or whoever, I mean, they're not used to these kinds of things.
Now, I suspect what is really going on is this, speaking to a domestic audience, trying to move on China's sense of, or cultivate a sense of nationalism, where they don't want to show weakness, where they want to show that they are standing up to the world, they're not going to get bullied. Part of the rationale for the opening up is to make sure that trade and economic flows and business exchanges can happen again. So if China's going to impose reprisals, then that's counterproductive to part of the rationale for what they want to do in the first place.
Ultimately, with the resumption of global travel, placing restrictions only on Chinese tourists will be futile.
If there was a new strain emerging in one part of the world, measures will not stop that strain from getting to other parts of the world, whether it's a new strain emerging in China, a new strain emerging in the United States or elsewhere, anywhere in the world, so that the virus can get around those travel measures, unless you do what China had been doing a year ago, what Singapore had been doing 2 years ago, which is every traveler goes into a quarantine facility. Without going to that extreme, then I don't think travel measures really have many rationale.
On January 15, the WHO received new data from China. The agency said that the reported data indicate a decline in case numbers, hospitalizations, and those requiring critical care since the spread of infection started in December last year. This suggests that China has crested the COVID wave. Consequently, the risks associated with Chinese travelers and the need for restrictions will diminish.
Actually, when we look at traveler testing data in Taiwan, in people who've come from the mainland, that was 20-30% maybe a couple of weeks ago. It's now down to below 10% positive on arrival by PCR. So it looks like the peak was early January, late December nationwide.
I think chances are very good that things will have to get worse before they get better. Now, in terms of the most optimistic scenario, I think it's if the CCP and Xi Jinping's bet works and infections, hospitalizations, deaths are sort of under control. There is herd immunity, and there may be a slight disruption in the beginning, but then things smooth out for the rest of the year.
China is very committed to getting the economy back on track. And the virus aside, that is actually a matter of some relief for the rest of the world. So for the rest of the world, it really is a matter of sort of striking their own balance about how to sort of gradually open the door to Chinese tourists, Chinese business visitors, Chinese business. Yeah, I think this is going to be one of the definitive issues of this year, going forward, the next few months.
With expectations that travel restrictions will ease in the coming months, around 60% of Chinese surveyed say they plan to travel overseas. A freelancer in the media industry, Yang Xiao, for one, is looking forward to this return to normalcy.
这个过程需要慢慢抬头嘛，对吧？也肯定是要在这个过程当中再发现一些动态的变化，然后再及时去调整吧。肯定是希望它越来越好吧，各种情况吧，从生活到工作这块，等这个所谓的这个限制解除之后，那肯定，到国外去旅游啊，或者去出差啊，或者什么的，如果有这种机会的话，都没有问题。
China's reopening had come with a mounting death toll. But if the worst is truly over, there is some cause for optimism, not just for China, but the world.
The pandemic risk has passed because the virus is now circulating globally. I think China was the last holdout. So now that China have moved to living with the virus, I think that will be the trigger that we should declare the pandemic is finally over. And that will be a relief, I think. The virus hasn't gone, but there's no longer such a strong rationale for public health measures in the long term.
疫情發展到依家呢個時間，其實都可以叫做進入尾聲㗎啦。進入尾聲嘅意思即係話唔係話佢會消失，而話佢已經係變成一種風土病。
这个事情确实让我们明白了很多道理，有些东西都是没法预测的。生命很无常啊，唯有向前才是需要直面的东西。整体这件事来说，就是人们还是要因为前面的路还有很多，那我们不要往回头看，应该前行吧，往前面看还是更重要的。
10 years after the deadly conflict between Sabah and Sulu,
lahat-lahat mga 60 plus ang namatay sa amin.
The scars remain.
Masih trauma tu masih ada lah sebab nampak lah bekas dia.
Could deportations and the court case reopen old wounds?
Sabah really belongs to the Sultanate of Sulu.
Dia baru macam semalam dia berlaku kan, sudah 10 tahun. Dan kesan dia tu masih kita boleh lihat.
Lahat Datu, the Sabah-Sulu conflict. Insight, Thursday on CNA.